is CC&C evolving to support virtual care models, like hospital at home and remote monitoring? Where do you see this going over the next year or two?
Virtual care is being proven in lots of situations, whether it's a nurse at a distance who's doing admissions and discharges within the four walls of a single hospital. But many organizations are thinking about scaling it so that those virtual nurses are in a center and taking care of patients across multiple hospitals. There are organizations that have large transfer and patient placement centers. There are hospitals that are developing specialty care such as wound care or nutrition care, so that they can reach a lot of patients without the nurse having to travel so much and making them work more efficiently. And those folks who are providing care at a distance really need to be part of the care teams that are at the bedside. And so a CC&C platform has to make it seamless for those folks to be able to communicate to the care team at the bedside, and for the bedside team to be able to find those folks who are providing care at a distance. So we're working very hard to make sure that they're seamlessly integrated, that they're seamlessly part of the care team, and that they can see the broad array of patients that they're taking care of, no matter which facility they're in.
Kathleen?
I think virtual care has actually been a catalyst to the communication, collaboration, and care coordination that's really required, because when you have patients that are outside the four walls and you have staff that's located elsewhere, they really need the ability to be able to coordinate and collaborate more seamlessly. So having a platform and having the ability to be able to do that is really important. Virtual care is here now. It's here to stay. We're actually seeing quite a bit even within our government, where they're actually regulatory saying that they're going to reimburse more. And so I think we're going to start to see more and more of that. We're also seeing that patients are being moved out of the hospitals to do hospital at home. So we're seeing sicker patients in their own homes, and patients would actually rather be in their homes sometimes than they would be in the hospital. So I think that as we look to things like remote monitoring, ambient monitoring, we're going to see more and more ability to be able to do the virtual care, and it'll become more of a standard of care and much more common than I think even we ever thought it would be in the past.